Hello students, today we are going to discuss the ninth cranial nerve. So these are the important headings under which we will discuss the nerve. That is the introduction point, then comes the functional component, then comes the course, then comes the branches and applied aspect. Now this nerve is developmentally, if we come to the introduction portion of this nerve, this glossopharyngeal nerve is the nerve of third pharyngeal arch. Developmentally if we see, it is the nerve of third pharyngeal arch. Now it has two components, that is motor and sensory. The sensory component of this nerve is larger one and the motor component is smaller one. Then this nerve, it bears the two ganglia, that is superior and inferior ganglia. Then if we see that this nerve, it leaves the medulla oblongata, that is through a gap between the olive and inferior cerebellar peduncle through 4 or 5 rootlets. So if we see it, that is, if this is the olive portion, so this nerve, it leaves it through the 4-5 rootlets between the olive and inferior cerebellar peduncle. Between the olive and inferior cerebellar peduncle, this nerve leaves the medulla oblongata. So this is the introductory part of this nerve. Now coming to the functional components. The functional components of this nerve are special visceral efferent, then comes the general visceral efferent, then comes the special visceral efferent, then comes the general visceral efferent, and then comes the general somatic efferent. Now these are the functional components of this nerve. This special visceral efferent component, they are arising from the nucleus ambiguous. And they are going to supply the muscle, that is stylopharyngeus muscle. So this is special visceral efferent. Then comes the general visceral efferent. This is arising from the inferior salivatory nucleus. And ultimately, these fibers which are arising from inferior salivatory nucleus, they are going to supply the parotid gland. So that pathway we will discuss separately. Now this special visceral efferent is basically, these are the central processes of the neuron which are lying in the inferior ganglion. So they are just carrying the fibers, taste fibers from the posterior 1/3 of the tongue. 1/3 of tongue. And they are going to nucleus of tractus solitarius. So they are going to nucleus of tractus solitarius. Clear? Now this general visceral efferent fibers, these are again the central processes of the neuron which are lying in the inferior ganglion. So these are the central processes of the neuron lying in the inferior ganglion and going to supply the carotid body and sinus. And these fibers are also terminating into the nucleus of tractus solitarius. So they are lying, these different nuclei, they are lying in the medulla portion. So nucleus ambiguous nucleus is thus sending the fiber to the stylopharyngeus muscle. Inferior salivatory nucleus, which is lying in the medulla, that is sending the fiber to the parotid gland. So this special visceral efferent fibers, they are terminal station or end station of this is the nucleus of tractus solitarius. And same for the general visceral efferent, that is fibers, central processes of those neurons which are lying in the inferior ganglion. They are going to the carotid body They are going to supply these carotid body and sinus, and ultimately they are reaching to the nucleus of tractus solitarius after taking the information. Now this journal somatic afferent, these are basically the fibers which are taking the pain and temperature sensations from the posterior part of the tongue, that is from the tonsil. So these are the component from where the pain and temperature sensation fibers are taken, from tongue, tonsil, auditory tube and middle ear. And these fibers of general somatic afferent, they are going to the spinal nucleus of trigeminal. So these are the important functional components of this nerve. Now coming to the course of this nerve. So next important heading under which we will discuss the glossopharyngeal nerve is, that is course of this. Now after leaving the medulla, so 5 or 6 rootlets, they join to form the one nerve which leave the medulla through a gap between olive and inferior cerebellar peduncle. As I have told you, after leaving the medulla, what is happening? The nerve, it moves or laterally and anteriorly, and it passes through the jugular foramen. So this nerve is passing through the jugular foramen in front of the vagus nerve. So this is 9th nerve, here is the 10th nerve. Now after leaving this jugular foramen, this nerve in the neck portion, what are the important relations of this nerve? First, it runs between the internal jugular vein and internal carotid artery. After that, it passes between the internal carotid artery and external carotid artery. Then after that, it reaches the lateral surface of the stylopharyngeus muscle and wind around the stylopharyngeus muscle. Then relation is with the stylopharyngeus muscle, that is reaching the lateral part of it, lateral part, then wind around it and come anteriorly. Clear? It enters the pharynx. It enters the pharynx by passing between the gap of superior and middle constrictor. Passing through this gap, it enters the pharynx. Once it is entering into the pharynx, it moves forward, going towards the tongue. So what are the important relations of this nerve here? That it is passing deep to the hyoglossus muscle, deep to the hyoglossus muscle, and superficial to genioglossus. Superficial to genioglossus. So once it is passing in relation to this hyoglossus and genioglossus, here it terminates by giving the different branches to the tongue. So this is the course of the glossopharyngeal nerve. Now coming to the branches. Now what are the important branches of this nerve? So we will discuss the branches with diagram. Now this nerve, as I had told you, so it is just coming from the this is the jugular foramen. This is jugular foramen. Clear? Now as this nerve is passing through this jugular foramen, it bears the ganglia. I told you that it has two ganglia, that is superior ganglia and inferior ganglia, which is just lying beneath the jugular foramen. Clear? Now once this nerve is leaving through this jugular foramen, it is coming here. From this inferior ganglia, one nerve it arises, which is the tympanic branch. So this is the tympanic branch. So first branch of the glossopharyngeal nerve is the tympanic branch, which passes through the tympanic canaliculus lying in the lateral wall of the jugular foramen and enter into this portion, that is petrous part of this, and form a plexus over here, that is tympanic plexus. Now next branch which is arising from this is, that is to stylopharyngeus. Then it gives the carotid branch. So carotid branch to carotid sinus and body. Then it gives the tonsillar branch. So tonsillar branches they arise. Then this nerve it gives the pharyngeal branch. This pharyngeal branch it forms a plexus known as the pharyngeal plexus. Clear? Now coming next to it, after giving these branches, this nerve comes. As I had told you, it is coming in relation to the genioglossus and hyoglossus, and it gives the different branches, which these are the lingual branches to the tongue. So this is the line diagram showing the different branches of the glossopharyngeal nerve. Now this tympanic branch, it passes through the tympanic canaliculus and enters the petrous part of the temporal bone, where on the promontory it forms a plexus which is known as the tympanic plexus, and from the another end of this nerve leave through the canal, that is as the nerve that is lesser petrosal nerve. Lesser petrosal nerve in the middle cranial fossa, and this nerve it leave the cranium through the foramen ovale and come out to supply the parotid gland. So these are the branches of the glossopharyngeal nerve. So if we enumerate it, first branch is tympanic, then it gives the stylopharyngeus, then carotid branch, then tonsillar branches, then pharyngeal branches, and then the lingual branches. So these are the branches of this. Now coming to the applied aspect. Now this pharyngeal branches, they are going to the form the plexus, pharyngeal plexus. So definitely if this nerve is involved, the you can say the sensation, that is loss of sensation from the pharynx, it may happen if the injury to the glossopharyngeal nerve it is there. Then as this nerve is going to supply the stylopharyngeus muscle, if the involvement of the nerve is there, then weakness of the pharynx, pharyngeal muscle will be there. Then also it is taking these branches, lingual branches to the tongue, that is posterior 1/3 portion along with the circumvallate papillae. The taste fibers are taken up by this glossopharyngeal nerve, so that will be affected. Then loss of gag reflex will be there. So these are the aspect of the applied aspect of this. As I had told you that this tympanic branch is going to supply the parotid gland. So if it is affected, if this glossopharyngeal nerve is affected, so loss of salivation will be there because branch to the parotid is affected. So these are the important applied aspects of this. If you want, I will write also that what are the different that is loss of sensation of pharynx, then weakness of pharyngeal or pharyngeal musculature, because then because of the pharyngeal plexus is involved, loss of gag reflex. Then parotid innervation is affected, loss of salivation. Then taste fibers are also affected, as I had told you. So because posterior 1/3 of tongue is giving the taste sensation to the glossopharyngeal nerve, and that is taking those fibers to the higher center, so loss of taste from posterior 1/3 of tongue. So this is all about the applied aspect of this. Now, what you have to keep in mind is that while writing any nerve or in the examination, so you should know what are the important headings you should cover it. So that I told you. Thank you very much.